We're going to spend a little bit of time now with inflammatory bowel disease. And inflammatory bowel disease is going to be broken down into two types. We're going to have ulcerative colitis and Crohn's disease. Both of them are characterized by exacerbations and remissions. The onset is usually during adolescence. We sometimes see it in younger children, but look for the adolescent age group. Don't forget, always read the test question, look at the age, look at the sex. Is there a specific etiology? Well, it's hard to say sometimes, but we do know that they just present with these, and it's an inflammatory. It could be an autoimmune type disease. It's hard to say. With Crohn's disease, one thing to use to differentiate that from ulcerative colitis is, first of all, remember that Crohn's disease is anywhere from the mouth to the anus, whereas ulcerative colitis is more restricted to the colon. Crohn's disease is also notorious for more extraintestinal manifestations. So when you're reading the test question, if they start talking about rashes, if they start talking about persistent fevers, if they start talking about arthritis or abscess formation or fistulas, absolutely think of Crohn's disease. The definitive diagnosis for either of them is going to be endoscopy, but it'll guide you one way or the other. If they have extraintestinal manifestations, think of Crohn's. Ulcerative colitis is really limited to the colon. And of course, the diagnosis is going to be on endoscopy with biopsy. The treatment includes dietary. You want to avoid certain things that, for example, with the strictures that occur with Crohn's disease, you want to avoid like corn and carrots and things like that, which actually aren't as well digested and can plug up the strictures, and then you can get intestinal obstruction. Certainly also need proper nutrition. They will use steroids, they will use anti-inflammatories. Lately we've been using immune suppression therapy, and sometimes they need surgery.